I have a pacemaker which was installed in 2004, and I went to have the generator replaced in early December, and a routine surgery. And a couple of weeks, literally 2 weeks after that, I just started feeling flu, feverish, just general aches and pains, which coincided here with the beginning of our winter break. I went up to New Hampshire, where I spend my vacations, and just collapsed in bed. And a friend up there, after watching me for 2 days, literally just shaking in bed uncontrollably, said, "You're going to the emergency room." And when they kept me for a few hours, they realized how serious my condition was and flew me down to Yale.
So Mr. McCatty, when I saw him for the first time, he was very sick. He had severe leak from his mitral valve as well as tricuspid valve. Some part of the valve was destroyed because of the infection process.
There were many doctors coming at me saying, "We've got to do this," just taking tests. But he was a very patient person.
It was very clear that Mr. McCatty needed heart surgery. And the question was how to avoid the invasiveness of the surgery, but to get a maximal outcome, a good outcome. He
always took time to explain things to me and to weigh options, and he would say, "This is what I want to do, this as opposed to that. This is how I see your condition, and I see various paths we can take."
In the context of that, I chose a keyhole approach for fixing both his valves that would have allowed him. The thinking behind that was that it will allow him to recover faster and would reduce the amount of invasiveness.
And another important decision that he made was not to go in by cracking my ribs, which is the typical traditional surgery for getting at the heart. And in terms of that, that means the recovery from even and the pain afterwards are much less.
I chose an approach of keyhole where what you do is that just close to the right armpit, you take a small incision, or you make a small cut, and through this cut we repaired both his mitral valve as well as his tricuspid valve.
He and his team, his assistant Maureen, who is a dynamo in keeping up with things and making sure that everything happens in its time and in its place.
So following the surgery, Mr. McCatty did very well, and he was able to breathe on his own within a day. His breathing tube was removed, he was able to walk, and he gradually regained strength. In spite of his serious condition before the surgery, he recovered very well to return to his job, and it continues to do very well.
Without a doubt, I am grateful to Dr. Bonde. I've been given a second chance at life, and I've been welcomed through that back into community that I realize appreciates me.